Welcome, Your Grace. It is so good that with all of your godly duties of sky, sea, and earth, that you are making time for your health, and in today's case, your nerve health. Now, I know that you are a very busy overseer, and so we won't delay a moment's more. May I ask, Your Grace, is it all right if we proceed with your cranial nerve examination? And where appropriate, would it be all right if I reached out and made contact? Thank you, Your Excellency. All right, let's begin. It's my understanding that in the last battle for heaven and earth that you might have taken quite the tumble and perhaps even encountered a collision. Is that correct? How have you been feeling? Have you been at all out of sorts? Oh, that is excellent news. Very good. Now I'd like to begin by assessing your sense of smell. Please tell me, how has your sense of smell been? Have you detected any absence of odor? Or have you noticed any unusual or new odors that maybe should not have been there? Okay, very good. Can we please test the airflow of your nostrils on each side? I'm going to reach out and occlude one nostril, and I'd like you to take a breath of air, a sniff, and then we're going to trade sides, okay? All right, here we go on the right side. Okay, and the other. Very good. Seems like you're getting sufficient airflow, and we can adequately test your sense of smell. Lovely. Okay, now I'd like you to do me a favor, Your Grace. Could you please kindly deactivate your all-seeing eye in this moment? I'd like to present to you an object and for you to tell me what it smells like to you, but I don't want you to be able to detect it with your mind. I want you to be able to detect it with your senses. Is that okay? Wonderful, thank you. Now, if you could please close your eyes. Could you please tell me what this is to you? Did you say coffee? Coffee, 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 coffee. Very good. Good, 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 good. Excellent. It seems like your sense of smell is in perfectly good working order. Very good. Now we're going to proceed with the visual component of the cranial nerve exam. Could you tell me, good spirit, how has your vision been? In divine working order, it sounds. Very good. We're going to do a few tests here. I'd like you to take a look at our vision chart here. And we're going to cover one eye at a time. And I'd like you to tell me which line, the smallest line that you're able to read, okay? Let's cover up one eye. Could you tell me which one you're seeing? 10. Very good. And could you read it out loud for me? BEZOLCFTD. Very good. And now the other side. Cover up one eye. Could you tell me which line are you seeing clearly? The last one again. My goodness. Very good. Very, very good. Well done, well done. Now I'm going to assess how your pupils react to light. If you could please take a look at my nose and focus there. I'm going to bring the light from the side. Very good. And the other side. Very good. Again. Excellent. Very good. Well done. Your pupils look fantastic. Very good. If you could please, Your Excellency, focus on this object that I have, and I'd like you to maintain focus as I bring it towards and away from you. Coming towards you and away. One more time. Towards you and away. Excellent. If you could please maintain focus on the object. focus. Maintain focus. Well done. Very good. Very, very good. Your eyes are functioning very well. Now, how has your x-ray vision been? Oh, very, very good. Could you please still do me a favor and continue to deactivate your all-seeing eye? And I would like you to tell me what is inside the box that I have here. Do you say a key? A key. Very good, Your Excellency. You are correct. It was a key. Should we do one more test? Okay. I don't know if you're going to be able to guess this one. Okay. Can you please tell me what is inside the box? Did you say a ladybug? Oh my goodness. What extraordinary powers you have. You are correct. It is a glass ladybug. Very good. I'd like to assess some of the nerves in your face, please. If you could please clench your jaw, and I'm going to feel the muscles in your face. Clench again. Very good. If you could please wiggle your jaw. Excellent, well done. Now I'm going to place my fingers on your chin and tap to see if there's a reaction. Very good. We are expecting no opening and your jaw remained relaxed. Very good, Your Excellency. Okay, now I'd like to take a cotton wisp and we're just going to gently brush it, tap on different areas of your face. Please let me know when you've detected the sensation, okay? Now. Very good. 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 Excellent. Now, I'd also like to detect some of the sensation of discomfort in your face. I'm going to be using a pin. It shouldn't hurt, but you should notice a slight, very, very mild sensation of the blunt object here. I'll let you feel. Not too bad. Okay. Now, if you could please tell me when you feel a little poke. There. 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 Very good. There. 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 Very good. Okay. You know, it is so remarkable that you can both be so sensitive and also so resilient in all that you do, Your Excellency. Well, thank you for everything. If you could please follow along with me. Could you please show me your teeth? Smile. Gorgeous. Could you please frown? Could you please puff up your cheeks? And I'm going to try to pop. Very good. All right. Everything seems to be splendid, spectacular in your vision for our cranial nerve exam. I'd like to move on to assessing your hearing. Will that be all right? Okay, very good. I'm going to get you to rub or to occlude your ear on one side, and I'm going to whisper something in the other, and I'd like you to please tell me what I've said. Okay. All right. Lavender. Lavender. Is that what you heard? Very good. And the other side. Dinosaur. You heard dinosaur? Excellent. Well done. Are you hearing equally on both sides? For example, if I were to tap my nails on one side towards one ear, does it sound equal to the other? It's equivalent? Wonderful. I know you're having to hear all that surrounds you. Okay. In terms of taste, Your Grace, have you noticed any change in taste, diminishment, or excessive taste? Everything is as per usual. Wonderful. And could you please swallow for me? Could you please gulp? Okay, very good. I can see that you're able to swallow and that your neck appears even when you're doing so. Very good. This is kind of silly, but could you please stick out your tongue for me? And could you move your tongue one side to the other? Very good. Wonderful. Could you also open your mouth and say, ah, ah? Very good. Okay. All right. Now, I'd like you to please turn your head from side to side. Okay. Very good. Now, I'm going to apply some pressure, and I'd like you to do the same thing, okay? I'm going to put my hand here, and I'd like you to move your head to the side and resist the force that I'm applying. Ready? Push, 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 push. Very good. Okay, wonderful. And we're going to apply force on the other side. Okay, I'd like you to turn your head against my hand and resist the force. Push, 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 push. Excellent. Very good. Wonderful. Okay, and now we're going to do the same, but for your shoulders, I'd like you to shrug, shrug, shrug your shoulders, okay? I'm going to observe them on their own. Shrug for me. Well done. Now I'm going to put my hands on your shoulders. I'd like you to shrug again. Resist. Push, 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 push. Excellent, excellent, excellent. All right. You've been passing with flying colors, Your Excellency. It's to be expected, but it is always good to do a check-in, just like a pit stop, and make sure everything is in working order. How splendid, Almighty Spirit. It has been wonderful to have your company today, for you to make time for your health. Thank you very much for coming and for partaking in your cranial nerve exam. I'm going to pull out my electronic system and to document our notes. I'm going to bring it down. Just take a very quick summary of what we did today. I'm a very fast typist. Okay, quick diagram draw. Perfect. Excellent, excellent, excellent. Very good. Okay, there we go. All of your results will be available in the cloud. Okay, thank you again, Your Excellency, Your Grace, for making time, for coming in today, for checking in. I wish you the very, very best.